that way, anybody actually can have anxiety disorder. It's for some kind of anxieties, they are commoner with females. Some kind of anxieties, they are same for both genders. And now one will ask, why would one have anxiety disorder? Well, there are various factors. We look at the genetic factors. People have it in their families. But I must say that it's not one singular cause. We don't look at just one risk factor. There are many risk factors. So childhood events too can sensitize one to become more responsive to threats. And then also stressors around. So events that are looked at as threats can trigger somebody to become anxious. But I must add this, that anxiety is usually not always as a result of the environment. So it is how the environment is perceived. So someone can feel threatened. For example, someone who has fear of flying, just is threatened that something will happen to him or her, even though it is a perceived notion. It doesn't mean that something will actually happen. It's just the person that feels that way. Someone who's experiencing a panic attack feels like, oh, I am going to die, I'm going to lose my mind, but that is not correct. So it's a perceived thing. So it could be as a result of stress. It could also be events could occur in one's life that leads to anxiety. Those are the causes. Many factors put together, risk factors coming together, that could possibly cause someone to have an anxiety disorder. Finally, in terms of his treatment, one will say that, first of all, like I mentioned earlier, you do investigations, the doctor will do investigations, and after they've done all those investigations, the treatment may then entail psychotherapy. For anxiety disorders in particular, what we do first is to employ psychotherapy. Psychotherapy is just saying that talk therapy. So there are specific therapy models that is used to address anxiety disorders. But one of note is called the cognitive behavioral therapy, which is extremely effective in attending and addressing anxiety disorder. Another thing that can be used are anti-anxiety medications. Anti-anxiety medications are just basically medications that once used, every time the individual takes it, it reduces the symptoms of anxiety that they experience. But the clause there is that anti-anxiety medications, which are largely benzodiazepines, can become addictive. So you are not advised to use those medications for too long. The standard practice is not to allow you to use it for more than 2 weeks. That's the safe time. Then there's also the use of antidepressants in the management of anxiety disorders. Antidepressants can be used for a long period. And finally, you can do a combination of both medication and psychotherapy. I hope that just listening, you will be able to type and maybe understand what you may have been experiencing. Like I said earlier, if you have a challenge with these things I've said, you may need to seek professional help. And when you seek professional help, these are some of the things you should look out for and ask your doctor so that you could have solution. I think in conclusion, it's worthy to seek help if you find yourself in this situation, because even though everyone experiences some form of anxiety or worry at some point, but when it becomes very intense and it begins to affect your functioning, one thing that anxiety does is that it takes away your quality of life. For example, there are situations where people are so anxious they can't leave their homes. They are so anxious they can't fly. So if, for example, they have businesses that will require them to fly to somewhere else, they may lose those businesses because they have a fear of flying. And so there are people who have social phobias, and their job may require them to interact with people. Their job may require them to talk to people. People have such distance. So it generally just reduces your quality of life. And I want to stress this, that you don't have to reduce your quality of life, because anxiety will cause you to avoid a situation that you are uncomfortable with. But trust me, that is not the solution. The solution is seek professional help, get help, and improve your quality of life. Thank you.